all global deaths. Well, these are some very troubling statistics. Again, a significant portion of these deaths that I mentioned, the 19.8 million, at least 38% of them in the year 2021 occurred prematurely. And here we mean people who died before their life expectancy from birth. All right, premature death. Kwame, what do we know about cardiovascular diseases and heart health? Well, we know that unhealthy, there are some behavioral risk, things that you and I do that increases the chances of us developing cardiovascular diseases. And some of these things are unhealthy dietary habits, excess salt, excess sugar, and excess fats. So when we talk about unhealthy dietary habits, too much salt, too much sugar, too much fats. Number 2 behavioral factor is physical inactivity, and then tobacco use, and then also the harmful use of alcohol. These are major contributors when we talk about the behavioral factors. So last week we had the walk with Lexis, right?
Absolutely. It was good to wonderful see you and the missus.
Oh yeah. Oh yeah, dear pa.
I'm impressed.
8 kilometers. We had to descend, because we are coming from Equape, we had to descend. So when you guys were warming up, coming now your engine, we needed cooling break. So we descended and then we went back up again.
Great.
So physical inactivity will increase your risk of developing cardiovascular diseases.
Right.
It will increase your chance of missing a heartbeat. And we don't want you to miss a heartbeat. Right. So, Kwame, because we talked about alcohol, I decided, and we know that it's one of the behavioral risks, and we talk about the harmful use of alcohol. And I decided, why don't we talk about heart health and alcohol consumption? All right, the harmful use of alcohol. Right. So, when you drink alcohol, to an extent, you get some benefits in terms of your overall cardiovascular health.
Bohobio.
That what me mohobio. Oh, no, can back up. Because people like Philip and the team, they will take that thing and run with it. And I just need to say this so that I can dismiss it. People will say, they've done some studies and they yeah. It's some small benefit. But our focus today is going to be on the abuse. All right? Kwame, there's clear evidence that increase or the abuse of alcohol will lead to increased cardiovascular risks. All right? There's something we call alcoholic cardiomyopathy. There is systemic hypertension or high blood pressure. There is heart rhythm disturbances. So your heart beats to a specific rhythm. And if you abuse alcohol, you disrupt that rhythm. And that is not a good sign. We call that arrhythmias.
About discord.
About discord. The way you were dancing on the stage. When we were doing the aerobics.
Doc.
Yeah. The 4th factor is hemorrhagic stroke. The risk of strokes also goes up.
I see.
All right. So these are the reasons why we need to talk about the harmful use of alcohol and heart health. So, Kwame, the topic or the disease condition is something we call alcoholic cardiomyopathy. Cardio means heart, myo means muscle. So we're talking about heart muscle, all right, which is a very, very unique muscle. And pathy means disease. So we're saying that if you abuse alcohol, then there's a high likelihood that your heart muscles get diseased. All right? And I mean, more than once we have spoken about the acceptable limits, of alcohol, the standard units. And I would always say this: If you don't already drink, there's no good reason. There's no medical reason why you should drink. All right, you don't get any benefits, but there are a lot of social reasons why. We'll drink alcohol. But then, if you want to drink, then you have to drink alcohol or use it safely. All right. So we've talked about for men the limit being 14 units, of alcohol, the maximum that you can do in a week.
You know what? 14 bottles a day.
Kwame,
I didn't hear you.
The units, the standard drink. Units
but
of alcohol.
14 bottles. 14 units. I need to be sure what you are trying to say.
40 units of alcohol. And 1 unit of alcohol. Alcohol forms. We have spirits.
Yeah.
We have beer. We have wines.
Yeah.
All right. So if we are talking about beer, then so the standard,
the small or the big?
Not the big one. Big one is
okay. So
the small bottle.
Yeah.
So
one is 1 unit.
That's one. Yeah. That's getting to one unit.
So if I go to the place and they don't have the small, they have the big bottle. What do I do?
Enter breathy. Then if you're talking about a glass of wine, a standard glass of wine is also 1 unit.
Okay.
And then the third glass for spirit is also 1 unit.
1 pay. Hey, sorry, you mean 1?
Yeah, Kwame.
Sorry,
and then a spirit. I don't know a spirit. We want to be spirit. All right. So and that's what we mean. So if we are talking about the unit, then we are saying that that's the maximum. Then for the non,
and you said for men.
Yes.
So
that's the maximum.
Women, is it the same for women?
No,
it's not.
It's lower.
Okay.
All right. 7 for women. In a week.
But what men can, women can. Never mind. It's okay.
I mean, this is where it doesn't apply.
It doesn't apply.
No. The equality or the movement, they shouldn't come there. Well, the research has shown that it takes lesser exposure for women to develop alcoholic cardiomyopathy compared to men.
Oh wow!
Right. So we're talking about the non-pregnant female anyway. So this is alcoholic cardiomyopathy is a cardiac disease caused by chronic alcohol consumption, and it is characterized by an enlargement, of the ventricles, which are the pumping base of the heart. Alcohol and its metabolites are cardiotoxic. That's one. We're not kidding about it. Alcohol and its breakdown products are cardiotoxic. All right. We, as of now, don't know the certain amount of alcohol that is known to be toxic. So that's why we set the limit. We say that if you go beyond this limit, then you get a lot of harmful effects, not just to your heart, but today I just wanted us to focus, on the heart. So if you start doing 6 to 8 standard drinks a day for about 5 years, then there's overwhelming evidence that you're going to develop alcoholic cardiomyopathy. So Kwame, it's not just an overnight thing. So you are doing 6 to 8 standard drinks. Kwame, we've talked about what the standard drink is.
Right.
So imagine somebody taking 6 to 8 thoughts of something hot every day for 5 years. Well, that's what's going to happen. Your chances of developing alcoholic cardiomyopathy will go very, very high. You're likely to develop it. So let's all keep that, in mind. What are some of the symptoms when you develop alcoholic cardiomyopathy? Your heart has become too large for it to function well. Well, you may get worsening shortness of breath. You may have difficulty in breathing when you lie down. You may suddenly wake up feeling out of breath at night. You may also develop palpitations. And then you may actually have fainting episodes that can occur due to what we call tachyarrhythmias. The arrhythmias are the irregular heartbeats. Tachy means very, very fast. So if you have tachyarrhythmias, then it means you have these abnormal heart rhythms and your heart is going, that kind of thing. So these are some of the symptoms. Again, I'll go over them worsening shortness of breath, which can be due to a number of different things, difficulty in breathing lying down, sudden loss of consciousness, and then palpitations.
Okay.
So these are some of the things that can happen as you develop what we call the alcoholic cardiomyopathy. The patient may also show signs and symptoms of diseases affecting other organs. So we all know that the liver takes a hit, but I don't think most people knew about the heart also taking a hit. So when you may have symptoms referable to the liver. So you have symptoms of liver disease, the jaundice, being the thing that most people can easily recognize. You may also have folic acid deficiency, and therefore you look at the red blood cells, and then you have a certain type of anemia, and then you may have some nerve, problems as well, and then the shakes, as they call it. Now, if a doctor suspects that you have developed alcoholic cardiomyopathy, and the suspicion would only come when you have some of these symptoms, and we take a history, and Kwame uchapa, been drinking. So from the history, we get to know, all right? But the doctor will conduct further tests to further the diagnosis. We'll do, say, a full blood count. We'll do a liver function test. Would ask for a chest x-ray, because Kwame, one of the key features of this alcoholic cardiomyopathy is that the heart slit is big. The heart shadow, the cardiac shadow, when you take the x-ray, it's sort of like filling up the whole left side, of the heart. So a chest x-ray is very, very important. We'd also do something we call the ECG, not our people.
Okay.
Electricity Company of Ghana. This is an electrocardiogram. ECG. Where we stick some things on your chest. We also move kudus going from West Ham to Tottenham, and then all those medicals. We don't call it medicals, and then you stick those things on the chest. Then lastly, the doctor may ask you to do an ultrasound scan of the heart, an echocardiography. Treatment. I don't know.
That's the treatment.
Simple. The thing is alcoholic cardiomyopathy. So you just erase the alcohol from there. Stop drinking. Stop it.
Oh.
So
the pharmacists, what are they doing?
The what?
The pharmacists.
Oh, they are looking for cure for what will come after COVID.
They should find some pill that if you drink, if you take it, then it will just dissolve the alcohol thing in your
your heart muscle.
Your heart muscle. And this is. I won't be impressed.
Pharmacists. All pharmacists on the call.
Yes, all the pharmacists listen to us. All the research that
Lexis is giving you work.
Yeah.
You are not focusing your research.
I won't be impressed with science until the pharmacists find a way that they make a pill. You take them now, then they alcohol.
Before or after?
After.
Yeah. So really, the treatment is directed towards source control.
Okay.
That is what is encouraged. You see, you're not going to continue doing that which caused it. So as great as alcohol may be, and as we know it's part of our social fabric, but then these are some of the challenges that it can pose for us. Of course, once you develop these irregular heart rhythms, the palpitations, high blood pressure, all those things, we will treat those symptoms.
Okay.
All right, we will treat those symptoms with different medications. However, source control is the definitive treatment.
But I'm sure you've got there are people who also have problems with alcoholism, right?
Yep.
So you probably have ways that you can, I don't know whether it's counseling or
therapy. You're absolutely right. There is
Alcoholic
therapy.
Anonymous,
Exactly.
Groups and those things.
Exactly. So at our mental health, unit, we've got a very capable team of clinical psychologists, psychiatrists, and they can help you if you need to break that habit. All right. There's help for that, and that is exactly how we'll direct it. And we're talking about alcohol abuse.
Yeah.
Not just drinking alcohol.
Yeah.
No. You know.
No, I know. Well, this afternoon you've made somebody who's listening very, very guilty. I know somebody's listening to me now, and they know in their hearts they have a problem with alcohol. Well, now you know what to do from here on.
Yeah.
For those who want to reach out to you and seek for help, how do they do that?
Well, the number is 0501 477 340. Our WhatsApp number 0501 477 340. If you have palpitations, if you have high blood pressure, you're worried that it may be due to alcoholic cardiomyopathy, reach out and somebody will be willing to help.
Dr. Osafo, thank you so much. Dr. Yaw Osafo is the CEO of Medicas Hospital in East Legon Hills.